So I will start with, or how many do you want me to do, Manjalali? I have 3 written up. 2? Okay. So I will start with client C. I guess I just wanted to share the whole form that I have them fill out. Sorry, I have a cat that's walking on my laptop right now, trying to get him out of here. And so after watching the encounter with the Pitta skin lady, Manjalali's encounter, I totally took from her information and health history form and made my own that was really, really helpful to go through. And so this client is from Hungary originally. So all of my clients are expats. They're all living in Saigon from wherever. This lady is from Hungary. She's kind of lived everywhere for her whole life. She's 44 years old. She is an extreme Pitta. She has 3 kids. She is a teacher. She teaches special education, and her own children also have special needs. The main reason that she wanted to talk to me is really had to do with mental and emotional self-development. She's kind of taking time now. She has a little bit of time to take for herself. She is very, very Pitta in mind, so she's like super driven, always working, always doing something, and she gives a lot for her job and for her own kids. So yeah, it's just really nice that she's taking the time to kind of work on her stuff right now, and she recognizes that she's got a lot of stuff. So the biggest part that she's focusing on at the moment is mental. But we ended up talking about food a lot too, because as you can see, she has a lot of allergies. She has an extreme gluten intolerance. She doesn't have celiacs, but it affects her a lot. She is allergic to casein. She's allergic to nuts. She's allergic to eggs. She is very affected by MSG. And then she's allergic to lidocaine. Yeah, so we just kind of went over the main things. She's pretty healthy. Like, she's a really healthy lady. She focuses a lot on being strong. I mean, she is Pitta minded, so she really ends up going for, like, she has a yoga practice, but it's a very strong yoga practice. It's been based in Ashtanga. So, like, a lot of sun salutations, moving very quickly, a long practice. And she's kind of now recognizing that maybe that's not the best thing for her. So she has been stepping back on her own from that and gearing more towards like a hatha yoga practice, longer holds, more focus on breath. She does have a meditation practice, sort of, kind of. She tries and then gets frustrated because it's very difficult for her. She said she really hates meditation. And she does have some very Pitta skin issues. She's got some psoriasis and eczema, but they only really come up when she's super stressed. So on a daily basis, it's pretty fine. She has dry skin, and sometimes it'll be a little bit irritated. But anytime that she has high stress in her life, that's when those things will flare up. You can see she also had hyperthyroid issues when she was super stressed. So at this point, I asked her, do you have any previous significant health concerns, issues, surgeries that happened? And the hyperthyroidism was the only thing that she told me about. But then later on, and even here, when I said, are you on any medications or birth control, vitamins, HRT, she said no initially. Except for B12 and zinc and then vitamin C. And then we got to the very end when I asked her if there was anything else that she thought might be relevant. And all of a sudden she brought up like, oh yeah, well, I am actually on hormones, but I've been taking them for, 17 years because I had a hysterectomy. They took out my uterus and my fallopian tubes and my ovaries because I had an infection after giving birth to my child. So her first child was a natural birth, was a birth, and then her other two kids were adopted, and I didn't know that. So that was just kind of an interesting thing that happened. It completely was out of her mind. She didn't even think of it until the very, very end. And it kind of spoke to how, towards the end, I think that she felt a lot more comfortable. And even though she said over and over again when she was telling me about it that, it happens, it's okay, like it happens all the time, I know it happens all the time, she kept repeating this. Like, I don't know, to me it just seemed like there's some unresolved stuff around that for sure. I mean, it's a huge loss. I asked her if she had any time like that she grieved for it later on, when it happened, and she said, no, I had a newborn baby, what do you do? Well, I lost my uterus. What am I going to do? So you have a baby now, and that's what you do. So that was there. And then we started talking about her food intake, and she's really gotten to a place where her diet it's pretty strict. As you can see, she's allergic to a lot of different things. So she mostly eats at home. Sometimes she'll eat things that she knows that she has issues with just because there's nothing else to eat, and that kind of sucks for her. But like nuts, she said she knows that she's allergic to almonds, but she eats them anyway. Breakfast is a small breakfast usually. There's not a whole lot there. She specifically eats Japanese tofu because other soy she is allergic to. But this specific type of Japanese tofu is okay for her.
Sarah, sorry, this is Manjulali. I missed it.
Yeah.
So what was the chief reason for her consultation?
Was so it the chief reason she came in with was really just like, self-development and meditation. Okay. She just kind of wanted to talk about stuff. And she really, really wanted to talk. She talked a lot.
Yeah, you will notice people do that.
Yeah, and it seemed really therapeutic for her, like very cathartic.
Yeah, yesterday I got a call from Dr. Monica Single. She's a physician, right? And she's in San Diego. She called me and said I had a client and I did her 3-hour consultation, and then he called me and talked for 2 hours on the phone. So what should I do? I'm like, why are you asking me? Tell them you're going to charge them money if they're going to be on the phone for 2 hours. Yeah, you have to learn to have some boundaries. It doesn't matter what kind of consultation you do. I am very, very open with my clients, but I really set boundaries. You have to set boundaries because, and it's good for them to have a boundary too. So, having a timer and saying time is up, and, focusing and bringing them gently back to what the focus is important.
Which is exactly what you're helping me do right now too. So.
Oh, am I?
No. Yes, I'm rambling. So she is a vegetarian because she has a lot of allergies, and she's found that it just helps her a lot.
You keep on saying she's pitta, but she has dry skin, eczema, anxiety, and then all these. It seems like she has Vishamagni. She has Vayu issues going on. So either her Vikriti Vayu has gone up, or I don't know.
Yeah, she does have like a Vishamagni thing happening, I think. And she's definitely like a little bit higher Vata as well. So it's Pitta, Vata, and then Kapha. And the main thing for her was that she feels like she explodes emotionally, but in like an angry and irritable way. She gets irritated really easily, she feels. And she always feels like on that edge of yelling at somebody. Like she holds in.
Sorry, another question. How long has she been in Saigon?
She's been in Saigon for about a year now.
So go back to her diet. Do you see any difference? She's living in Saigon, which has lots of fresh fruits, vegetables. There is nothing tropical there. She's having, maybe except for coconut milk and tofu.
Yeah.
She's eating a Mediterranean diet in an Asian country.
Yeah.
What does that tell you?
She's trying to start cooking a little bit more in a Vietnamese sort of way. But one of the things here is that um, we have these gourmet stores basically that sell things that are more familiar to Westerners, and there's a lot of issues with pesticides
Ah,
in things that are grown here, and the soil. So we only get food if we know about the issues, then we only try to get the produce from Dalat, from this one area of the country that doesn't have like tons of stuff in the soil, because there's so many areas that are still affected from like Agent Orange being in the ground.
okay.
So she's, like hip and all the stuff, and she really wants to try to eat only organic, and
But
there's only
one
certain
thing I'd
foods.
like to say, Sarah, I mean, just apart from that, when I was in India, I used to work with expats from all over.
Mm-hmm.
And they would, again, we had this market in North Delhi. They would only buy everything from this North Delhi because they were afraid they didn't know what was in the Indian food.
Yeah.
But really, when you go to a new country, trying to eat local fruits, local vegetables, local cuisine will help you adjust to the energy of the new country.
Mm-hmm.
So it's kind of, I know even if there's food that's grown in Malaysia, or even if it's grown in Philippines, I know there's stuff grown in India that is sold in Asian countries that is
Mm-hmm.
organic. So at least in and these countries are 2 hours away from each other. It's grown in Singapore. Malaysia has a huge, so even like getting local milk, local bananas, it'll help balance. For me, I'm
Yeah.
looking at you trying to be like a foreigner in a local place. It's like when we Indians come to United States, we only go to the Indian store and we only want to eat Indian food.
Yeah.
And I did that for 6 months when I came here, and I got massive allergies because I realized everything that they were selling in the Indian store was not fresh. I mean,
Mm.
you have to go local. I mean, somehow.
Yeah, and I think she does with the fresh things, but and the brown rice. I know the rice is local, but obviously like quinoa is not grown here for sure.
No, this is just a general, because because you said every single client of yours is an expat, right?
Yeah.
And also we do this because we want to identify, we want to have if she's from Hungary, Hungarian people have that Hungarian stew. It's a very
Yeah.
famous stew. So she should be eating things like cooked stews and whatnot. Her value is,
Yes.
all over
Yeah.
the place.
Yeah. We talked about that a little bit. In the end, yeah, like soupy foods, more cooked stuff because she eats a lot of fresh salads, and so I'll just go down to the recommendations then. Is all this stuff like
So a couple of
most.
questions. Erin says, do you think she should slow down on the tofu?
Maybe. I don't think that she eats it that often
Okay.
because she does only eat this specific Japanese tofu.
What is
So
Japanese tofu?
it's the way that it's processed. Um,
They don't make it from tofu, the soy milk, the boiling the soy milk, and then
it's still made from soy, but yeah, I think that something in it allows it to ferment in a way that doesn't produce, what is it, gluten? Is it like a gluten that's
no,
produced?
there's a Japanese thing that they put in it, like vinegar. Like when we make paneer, we put lemon, and so yeah.
Yeah, so something in the way that they do it works better for her, and it doesn't bother her. But there, she doesn't eat it all that often.
Okay.
I think mostly she does vegetables because it's what's kind of easier
Yeah,
for
that's
her.
good.
She's a
Yeah, that's a
vegan
good thing.
for the most part, and I think that's kind of difficult sometimes for her with 3 kids.
Wow. Yes.
Um, so so yeah, we did talk a little bit about, because when she first got here and she was eating a lot of food that was more familiar to her, like Hungarian stuff. Oop, can you still hear me? Okay, is it back?
Yes. Yes.
Sorry, I don't know what happened. Okay, good. So she was eating a lot of heavier foods, and it's very hot here. So when we eat a lot of heavy foods, like we just end up feeling really heavy. Um, so she feels better now with what she's been eating lately. She feels really good. This is like the best place that she's been in years, I think she said, with her diet and the way that her body feels in general. Yeah, so again, just down here, it was really interesting that she only at the very, very end, she talked about having like having to go back to the hospital a week after giving birth because she said the stupid doctor left the placenta inside of me and it got very infected and I almost died. And they had to give me a hysterectomy, and so I wasn't able to have any more kids, even though I wanted them. And there were a lot of bits coming out that I think that meditation might help her kind of sift through and allowing herself to grieve over that loss, because it is a loss. It's like losing a piece of you. And then also that she has had a surgery for her knee. She like busted a ligament in her knee. So they took a big piece of a ligament or a tendon, something from her right thigh and put it in her knee, and her leg has never worked the same, and she's been going to an osteopath for some pain that comes up sometimes in it and getting a little bit of fascia manipulation done. And she said that, I asked her about her sweat, and she said, actually a couple of times I did smell bad, and I don't. And then we talked about it being on the right side, and that it was just after she got this fascia manipulation. So there's a possibility that maybe there's some ama built up in that area, either in the muscle or in the fascia. And she did have dry skin. The heels of her feet were super duper dry and cracked. Otherwise, she's quite healthy. And then she has the hysterectomy. And so she does have a bit of excess pitta, but in her like dosha test, it didn't seem like her vata was like too out of whack that way. But also just when we live abroad and travel as much as we do end up doing living abroad, that does kind of, I think, always give us a bit of a vata imbalance that's always kind of needed to be addressed. So there were a lot of things that we talked about, and I guess what I've been doing with the clients is when we talk to each other and see one another, I tell them to, if you want to take notes on anything that I'm saying, go ahead, because the bigger points I'm going to email. So I type them out and email them, and then, maybe we'll go over them a little bit again next time we see each other if they have any questions. But I don't want to overwhelm too much. So initially it's just the recommendations of CCFT plus a little bit of a star anise. The anise is to help with the lubrication in the body and creating a little bit more moisture. I've read that especially in women that have had hysterectomies, star anise can be really, really soothing and help in lubrication. She did mention that intercourse is a little bit difficult for her. Not only like in the libido sense, like she just doesn't really feel in the mood for it that often, but also it's a little bit painful because there's not enough lubrication happening in her body. And then steeping it and drinking it when it's cool or warm or room temp, but not hot. Trying to stick to cooked foods whenever possible. She was totally all about like raw salads, and did say when we talked that actually they do give her a little bit of gas and she does feel bloated. But she thought that, that's what is touted as being healthy. And we live here, so it's like you want to eat those kind of fresh stuff. But so to cook more foods and eat more soups, and we did talk about that a little bit too. And adding some more root veggies to the diet. So those are all over the place here. Squash grows all year round, and it's always delicious, and they have a lot of really beautiful variations of it. and here they call it pumpkin. And then a lot of like carrots and beets, those are also all year round. And then when she does use lentils and legumes, she says she kind of stays away from them as far as protein goes, because they do bother her. She said that they give her a lot of gas. So I asked her to just try it again, but before eating them, like soaking them overnight and then cooking them really, really well with black pepper, ginger, coriander, cumin, and fennel, and seeing how that worked out for her. And then when she does buy nuts, to soak them overnight and then let them dry out, because a lot of us have sensitivities to nuts because of the chemical in them. There's like a little toxin in there that's supposed to protect it from being eaten by birds and other animals, but it can actually irritate our guts, and soaking it helps with that, kind of draws out the toxin. And then when she's cooking, just using coconut oil and extra virgin olive oil, keeping it like really clean, not using too much in the way of like vegetable oils. They can be kind of, I know in my experience with my sensitive gut, if I use anything other than either coconut oil or extra virgin olive oil, it just, my body doesn't like it. It kind of irritates it a lot. And then a lot of Japanese sweet potatoes, they're really good for phytoestrogen. Flax meal is also really great phytoestrogen, and it creates a lubrication in the body too. And then
This
we
is
also have,
Manjulali. Sorry to
no, it's okay. I know I'm
question.
going through.
Yeah, first of all the things that you've given are great, and I don't know if you realized it. Her vata is also out of balance. She's not a pitta with excess pitta. She's a pitta with vata pushing pitta.
Mm,
And everything that you've given
that
is balancing her vata also. Have you? I don't even know if you noticed that you did that.
Well, I didn't want anything to aggravate vata, so that's kind of what I kept it.
Yeah. So this is a great thing. One thing I just want to add, just a
Mm-hmm.
little technical thing.
Yeah.
Brahmi and Gotukula are very similar, but they're not the same.
Okay.
Brahmi is another Gotukula, and then there is Bacopa monifera. The thing is,
Yeah.
they're so close, in their rasa, virya, vipaka, guna, even prabhava, that sometimes people interchange them for each other,
Mm-hmm.
and which is okay. But being someone who's studying Ayurveda, you should know that Bacopa monifera, Gorukula, Brahmi, not necessarily the same.
Right.
Yeah, but they're in the same family, absolutely, and very similar
Yeah.
as well.
So this one, Rauma, this one is Gotu-kola.
Yeah, also Shatavari is great because she's already taking, probably her body doesn't even know how to make estrogen or
No.
progesterone because she's been taking it from outside. So Shatavari is a great herb to give her, but not by like a dried form. I would probably want to give it in a kalpana form. So
Okay.
like a Shatavari grita,
Okay.
like the ghee, Shatavari ghee or
Yeah.
something like that. Or yeah, Sangeeta, there is it.
Or olive oil, because
Yeah.
she asked about ghee, but I've read that most ghees still actually have a lot of
Yeah.
casein in
Also,
them.
Dr. Priyanka is here. She wanted to listen to your client encounter, and she has to leave in a couple of minutes. I just want to ask her if she has any inputs before she leaves.
Mhm.
Priyanka ji? Priyanka ji, are you there? Okay, here she is. She just wrote in the chat window.
Absolutely. Thinking and overanalyzing. Yes.
Okay, so here you
Mm.
go. Dry virgin sesame oil, yeah. Yeah, I'm also like, I'm looking at the whole pitta. I don't see, I see definitely pitta's out of balance, but I'm seeing a lot of vata pushing pitta. So, balancing vata is, and anyway, moving into a new place, would do that to you. But
Hmm.
yeah, definitely. I mean, all the things that you're suggesting is actually helping your vata anyway, but it's the vata which is definitely out of balance. So it's really good job. Excellent work.
Okay. And then I was just seeing from Dr. Priyanka. So so overthinking and overanalyzing, is that it's more vata than it is pitta?
This could be both pitta. I mean, pitta person will usually, when they overthink things, they're always thinking from terms of I'm right, I'm logical. The other
Hmm.
person is not right. and they're analyzing it. But when a vata person is overthinking or overanalyzing, they're kind of, did I do this right? What if I had done this? What if this has happened? It's all
Uh-huh.
over the place. But from the pitta perspective, they're all, and also when you have excessive pitta in your mind, you would know within the consultation they might snap at you, or um, you know you have to be like a humble puppy in front of a pitta client. Oh, yes. Yeah, I
Um,
noticed, but you know what, Sangeeta? I don't think you want to change too much for this client. Like she said, this is a pitta person, and she feels that this is the best diet she's had ever. So if you tell
yeah.
her that mixing nuts and bananas are not good, she might take offense. And you don't want to offend a pitta person, right?
Yeah. I mean, mostly it was just because she has struggled so much in the past with her diet. It's been like, one of the biggest things in her life, and like she feels like she's finally in a good place right now with it. I just wanted to give like
Yeah.
a few things to try now, and then later on we can address some other things too.
Yeah. So
But she
Priyanka ji is also saying that you have to go with local produce, because
mm,
local produce will help also balance the mind.
hmm.
Because it's coming from you keep on saying the soil has a lot of things in it, pesticides are used, but there's certain things that even if pesticides are used, it's not affected. So pesticides affect fruit and vegetable most, and they affect grains, especially, they will affect maybe whole wheat a little less, brown rice a little less
Hmm.
comparatively. So even if small amounts of those things are eaten, like local grains and local vegetables, doesn't have to be a lot, even if it's small, it'll help ground you, because it's coming from the same soil, it's coming from the same country that you're living in. You want to
Yeah,
balance that.
yeah. So all of the produce is actually local.
Oh,
It's
that's
not
good.
the
That's good.
produce is imported, but like the nuts and grains are mostly all imported.
Yeah, you
Anything that's
probably don't want to do nuts and grains, nuts in that heat anyway, because she's pitta, and the nuts will increase her. I wouldn't even be surprised that nuts are possible, like giving, it's not, I mean, I don't think it's just the stress that is giving rise to the psoriasis. If you're eating nuts in heat, that will give skin issues to a pitta person.
that's so hard. All of
It
the
is hard,
vegetarians
I
go to
know.
nuts out here for.
Especially when you're not in your own country, it's much harder. And for someone like me, I don't know if Pradeepa and Sangeeta, how long you've been here. I've been here just over 10 years. I go to India, I don't belong there. I cannot digest the food from India, and they're like, what is wrong with you? Yeah, yeah, 11 years for me, Sangeeta. I can't digest. They all make fun of me that she's a foreigner. I can't digest their food. They put too much spices, too much onion, and then I order in, organic food from this store that sells organic food grown locally, and they make fun of me there. Say, why are you ordering organic food? So, like, I don't want to have grains that were grown in Punjab because they use pesticides, and I won't even go to an Indian store and buy. I know, but I know I've seen this, Priyanka. All the South Indians go, they will buy their idli rice and this and everything, and they are not going to. Indians will go in the Indian shop. It's because you want to, identify with the with your country. You want to have a. It's a cultural thing. There's a cultural thing here
Mhm.
as well.
Yeah, for
Yeah.
sure.
All right. I'm going to have Pradeepa. Let's do one case study that you shared. Is that okay? All right. If you could stop sharing, then we would go to Pradeepa. Good job. Thank you so
Yep.
much.
Thank you. Stop share. There we go.
So, Pradeepa, whenever you're ready, just click. Oh, there you go. I was very impressed with the whole, you know, approach here.
Okay, can you all hear me now?
Yes.
Yeah, I don't have a microphone either. I'm just using my computer speaker. So let me know if you have here echo. I can switch phones. All right. This client is her main concern is depression, and she is a 40-year-old female, average build. Um, she has a little obesity on her bottom half. Mental state is mostly depressed and emptiness. Um, and no concerns with her stools, no other concerns with her physical constitution. She does have thyroid, but she's on medication for that, and she tells me that it's in control. Um, and her pregnancy was 2 pregnancies and 1 miscarriage. 2 of the pregnancies were C-section. Um, no gas issues, no contraception. Her overall digestion is good. Her Agni test came out as Dikshagni. So coming to her diet, it's not so routine as what she said, but she has timely diet is what I think according to what she told me on her schedule. She eats breakfast after dropping her kids to school. So in the morning, it's mostly juggling around things, packing school snacks and her snacks. She also has a 9 to 5 job, and she sometimes don't have time to sit and eat a warm breakfast, so she eats something like a raw fruit, and she also eats a lot of sprouts. Lunch around noon, and dinner is around 8 o'clock.
Can we move to the chikitsa plan,
Sure.
please? Yeah.
Yeah.
I actually went through this case study.
Oh, you did.
Yeah,
Okay.
yeah.
Um, yeah. Quickly about her darshanam was she has a lean face, moderate build, broad abdomens and hips. She's not very happy about her physique and thinks she has to lose weight. Tongue, I saw mild vata, and also some crooked teeth. And her body was hot. Nari was actually hard to find. I don't know if that's because of her depression medications, but it was
No, if nadi is hard to find, it's vayu. Vata pulse is hard to find. So if you
oh,
press just a little bit too hard, vata pulse disappears. So that was telling me she sees vayu. She's vata prakriti then.
gotcha. Yeah, she's got yeah. I did feel fluctuating between vata and pitta when I pressed it a little deeper, but her skin was completely smooth and oily hair. Also some hair thinning. Eyes definitely looked dry and yellow. When I was talking with her, she was giving very long answers. She was very patient and very interested to listen to recommendations. But she was also so much to know about medications because,
Sorry, I just want to ask you this question. You said eyes looked yellow. Did they look,
uh,
the sclera of the eyes looked a little yellow?
yes, it did.
And then, so that is, if the sclera is yellow, that means there's a liver, usually in a jaundice that will be seen, or there's elevated liver enzymes that would be seen. So does she have any medical history related to that, or elevated liver
No,
enzymes or something like that?
no, she didn't. Not that I know of. No.
Do you think you could take a picture of her eyes?
Yeah, sure. Yep, I
Because
can.
if the eyes are really yellow, I mean, or
Right.
was it just like a general like creamy color, or I really
Yeah,
want to.
right. It's not yellowish. It's like, yeah, creamy yellow towards yellow, like very pale. But they seem to be dry to me.
So eyes looked a little dry. So that would be a majja dhatu, because the tears are
Mhm.
mala. Tears are a byproduct of majja dhatu. So if eyes are dry, then there is an issue with majja dhatu, the nervous system.
Okay.
And if it is yellow, if you notice eyes are yellow, immediately look at the tongue. Immediately
Hmm.
ask questions about liver.
Okay.
Yeah, yeah. So already we know that there is the ambuva shrotasis. The
Uh,
tongue was also dry.
no, tongue was moist, but it has some yellow coating, a white coating actually.
Okay, so yeah, so then it's nothing to be because if you see yellow in the tongue or the eyes or together, were you able to look at her conjunctiva?
No.
What if eyes are dry but also tear up a lot? I don't understand that question. If eyes are dry, we meant the dry eye syndrome, that if your body is not building enough tears, that is usually, which they call the dry eye syndrome, that's usually because of Majjadhatu, because your tears are a byproduct of your nerves. They are the mala of your nerves. So that is a little bit of, just Aaron, then there's a little bit of imbalance going on, probably some alochak pit issues. They want to probably use rose water in the eye. So, okay, thank you. Go on, please.
Okay, yeah. So when I gave her a link to her Agni test, she was really into medications because she's been taking medications for her depression and thyroid, and she says she also carries some ibuprofen in her bag most of the time. So she's so much into medications. The first time I gave her a link to the Agni test, she also did a lot of research on Banyan botanicals, and she came up to me with a list of herbs and asking me, can I use this and can I take that? So I told her in the first consultation, I'm only giving her some lifestyle changes and some changes in diet recommendations. Um, that's just to tell her her personality. And so I told her that she should favor mostly sweet and bitter foods, and because she doesn't take any
Sorry,
time off for
Raji.
herself.
Sorry, I have one more question.
Okay.
You mentioned she was taking some medication. Can we please have a list of the medications?
Yeah, I actually have it in my book. Give me 1 minute. I know it's Cymbalta for her depression, and she's also taking one more SSRI, and then there is a thyroid. So she got off one of her
When
depression
you say
medication.
thyroid, did you mean a synthroid for hypothyroid?
Yeah, let me look what that was.
Or is it she has, because if it is hyperthyroid, then it's an autoimmune issue. If it is hypothyroid, then it's low agni, low metabolism, and then they usually will prescribe synthroid for that. So with what?
Yes, it is Synthroid. Yeah.
Okay. So it's Cymbalta, SSRI, yeah. So can you tell me what are the top? I know I'm just trying to guide you into,
Sure.
what. So when somebody is on Cymbalta or any kind of SSRI, what are the top side effects of SSRI? Does anybody know? Anybody? There's quite a few side effects. Yes, dryness of mouth, mood swings, dry mouth. What about dizziness or nausea? Yes. Yeah. It can also cause dizziness, nausea. It kind of affects basically with your brain chemistry. It is affecting your brain chemistry, and which mostly, if you're, so there's two types of depression. If there's a clinical depression and that person is low in serotonin, or there's too much monoamine oxidase inhibitors in the body. So the clinical depression, they have to keep on taking it because it's actually a chemical imbalance in the brain. And then there is a depression which is not clinical imbalance, which is just that they feel down, which we talked about in Manasa, Vishada, right? So is she Vishada or does she have clinical depression?
I think she's Vishada.
Okay, perfect. That's all I wanted to know. Go ahead, please.
Yeah, so she's not really concerned about the thyroid at this moment because I asked her what exactly does she want to get out of this consultation. She really, really wants to get out of the depression medication, and she said she also noticed all these side effects. But I said I don't want her to stop it completely, but also try some of the alternate medication, and then she can cut down on it because
yeah. So
she
when
said
you
if
have a
she stops
client,
it.
yeah. So sorry. When you have a client, legally, you cannot say, I don't want you to stop it or I want you to stop it. You cannot use the word I legally. What you do
Okay.
is when somebody is on a medication, they said, I think we should consult your physician about reducing it. And while you're working with your physician on reducing that, I can work with you on the herbs portion, because we kind of want to give all the onus responsibility to the physician.
Okay.
So and you will find when people will come to you, they will be on medication. For me, every single person who comes to me is on medication. So I have had to, I actually went back to college to learn about medications in the United States last year and did a couple of courses because I'm like, oh my God, they're taking all of these things. What do they do? So
Right.
yeah, you really need to know. So, do a research for this immediately. The minute you say she's on Synthroid, the minute you say she's on the SSRIs, I know that her Samana Vata is probably affected. So I won't be surprised if she has malabsorption.
Right, right. Yeah, that's true too. She
Yeah.
does have malabsorption, and like you said, very low energy levels, and mood swings definitely. And she has bad temper sometimes. She loses her control on her husband and kids too.
Did you look at her
Um,
chart, her horoscope?
she says she doesn't believe, and she was not comfortable sharing that with me. And she's also a colleague of mine, so I didn't try to insist so much.
Yeah. Okay. All right. I know that's hard when you're working with colleagues. No, you did a really good job. I had gone through the first two clients that you had written. I looked you. I was very impressed with the darshanam because, when you're sharing your case study, by looking at your darshanam, I was able to make a picture in my mind.
Okay, thank you.
So that was really good. I like the fact that you used both everything that we taught you in the November workshop. You used the face and the lips and the nose and the tongue. And then, it's easier for when you're presenting a case study for everybody to make a picture when you do that. And at least she's open to recommendations. So I think ashwagandha is an excellent herb, but I would suggest definitely um, adding perhaps tulsi,
Okay.
tulsi tea, and also brahmi.
Yes, Brahmi, she already started Brahmi before my consultation. I told her to use mental clarity. She saw it on my desk and started using that. That's from Banyan Botanicals. I think Brahmi is a component of it. But I also gave her some samples of Brahmi too.
Yeah, and if she can, I don't even know if she's open to brahmi grita.
Okay,
Brahmi
with the
grita would
ghee.
be good.
Mhm.
I don't know, maybe probably already Dr. Priyanka has left. I know she's still here. Priyanka ji, what would you suggest? I think she might have left. Okay. Anyone? Is one of our Samir, you're there. Are you there, Samir? What would you suggest? He's almost done with his practitioner program, so I should have you take a class for everybody. Yeah, that would be very good, actually.
Okay.
And also, interestingly enough, when you have a person who's depressed or is unable to sleep, right? And then Bhringaraj can help with three things. Bhringaraj is cooling. It helps with the mind. It helps with depression, right? It supports that. It also helps reduces those elevated liver enzymes and also helps reduce acid reflux because it has affinity for the Ranjak Pith, right? So I don't know if this person is having trouble with sleeping. Is she having?
No, yeah, I did include that in the top section. No, she sleeps about 7 hours a day, goes to bed around the same time, has
Okay.
no problem, and doesn't even get up to use the
Yeah.
bathroom or something like
So
that. She's a good sleeper.
maybe like a formula that has Brahmi, Bhringaraj, and Ashwagandha in it.
Okay.
What is the best Anupana? Anupana is always customized for the person. Like if this person was, my head is swimming in case studies I've been reading. Like I just read 10 case studies by Connor. So I'm all confused who's what. But if this person, like she said they had yellow eyes, but if they also had a yellow tongue, so that means there's a pitta issue there. So I would have given Bringaraj either with grita, Bringaraj with ghee, or yes, or with whole milk, or even with aloe vera juice or pomegranate juice, depending on that would be, helping the pitta down. But this person is Vayu Pradhana, and there is some Vayu Prakopa, and the Vayu is Vata is pushing a little pitta. So balancing the Vata will automatically balance pitta here. And already Pathya and Apathya has been given. Everything that she needs to do has already been given. Only thing is, yeah, I would add the tulsi tea and definitely Ashwagandha will also help with thyroid, right? It will help with thyroid.
Right.
Yeah.
Yes, I also recommended the CCFT, and she started adding some mint leaves to it with the tea, and she says she loves it. And I see her bringing to work almost every day.
Yeah. Is she feeling better?
She says she's feeling better about that. Although I followed up about ashwagandha, she said she sees no difference with it, and but she also thinks that because of her depression medication, maybe
Yeah.
it
So don't
counteracted
tell
or
her that
something.
this is to do with depression, tell her
Okay,
this will help with her energy levels,
right, right.
which it will. I mean, so she probably has noticed her energy levels coming up, and it'll also help her libido as well.
Okay,
Low energy and libido. Yeah.
right.
All right. Good job. So I think that's it. It was a long class today. We are done. Thank you so much. Who is going to be, is anybody sharing client encounters next week? Jane, are you doing client encounters next week? Okay. So, one of the things that I really want, I'm not trying to criticize you or anything. I'm just trying to point you in the right direction. So when you do a client, okay, do you want to do, okay, great, that would be fantastic. I just want you to, be pointed in the right direction so you can get the best possible, um, because you're just starting in your client encounters, and you will have so many clients, and clients have so many different expectations. So if you join the practitioner program, we really talk about the Western medications and pathology of Western medication. We expect you to know that. Not so much in counselor, you're already doing a great job. I mean, you don't even need my help. But the idea is that we should be such good interviewers, and we should be able to steer it in the right direction. So that's pretty good. So yeah, I don't think Connor is here yet, but he actually finished all his 50 client encounters. And Vito or Tatiana, do you have any case studies? Are you getting started? Sangeeta, what about sharing that case with us, the one that you have been working with me? Yeah? Yes, that client. Yeah, because the more case studies we do, the better it is. And also we are closed in July. Okay. All right, namaste. Have a wonderful rest of the week. I'm sorry the class went a little bit longer than it's supposed to. Have a wonderful day. Thank you. Namaste.